This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
What happens if the first IVF cycle is unsuccessful? And if a person has PCOS, what are the chances in terms of percentage of getting pregnant?
Let me deal with that. Two different questions. Sorry, the first one was about what do you do if you fail. But the most important thing is to have a discussion with the doctor or the specialist, and preferably a specialist who understands the game. We keep saying the same things. Find someone who's committed to infertility, not a part-timer. Because they will look at the cycle, what the treatment regime was, what the number of eggs were that you got, what was the fertilization rate, what was the creation of embryos, how many were in, and looking at that and deciding, if we change things, can we do better? That's what we're aiming for. And that discussion is a standard. Obviously, I've said many times, 60% of cycles are not going to be successful. So I have this discussion every week. And we modify the regime, get better outcomes next time. Sometimes we won't, and we may call it a day. That's a conversation to have with a specialist who understands the situations of IVF. I've said already about the cumulative effects, and if you're unlucky and not get the 40% in the first round, and you've got other embryos, that 40% carries on for the next two rounds, or however many embryos you have. And then it's discussing how you're going to put that embryo back in a subsequent cycle, or you're going to start out again on a fresh cycle. But expert opinion is the important part, and having that conversation with a doctor who understands the situation. In relation to polycystic ovaries, okay, assuming the sperm and the tubes are open, and then as over 85-90% of women with polycystic ovaries will get pregnant without having to go through IVF if they're patient. Because in polycystic ovarian syndrome, the problem is lack of ovulation. That's why you're not getting pregnant, or irregular ovulation, so you don't get the timing right in having intercourse. With oral medications, and for a long time we used clomiphene, we've now moved on to use letrozole, which you only take for 5 days each menstrual cycle, and we can induce ovulation in over 80% of women at whatever dose is required. Sometimes you have to take 2 tablets, sometimes 3 tablets a day to get to that point. But in the majority of cases, we will get ovulation. And once we get ovulation, we're turning you back into a normal person in terms of chances of success, which is the 15% per cycle. That still means you've got to be patient once we get you ovulating. 3 months will probably get you a 40 to 50% chance of being pregnant just from tablets. If you go on for 6 months, you'll get up to that 80-odd% chance of a pregnancy. But that's with very simple oral tablets who have very few side effects. If that fails, we then move on to injections to induce ovulation. And that, again, is highly successful. The risks with that, however, are that because we're giving you injections, we may produce multiple eggs, and we may say, no, don't have intercourse. We don't want you to have quads. The commonest reason for quads is ovulation induction with injections without proper monitoring. Again, it comes back to fertility specialists that knows what they're doing. And a small percentage need to go on to IVF. And if you do need to go on to IVF, it may be because of the male factor or because of tubal damage, you've got very high chances of conceiving because, as I keep saying, it's a numbers game. And the good news about women with PCOS is that the more eggs you will produce more eggs than the average woman, and therefore you have high chances of success.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.